So I suppose while we're waiting, I just thought it might be helpful to give a little bit of sort of background to liberating knowledge. So it kind of started through my frustration that I felt that not only are the voices of communities often like missing from the evidence base, but actually that plays such a huge role in shaping how we understand why things are the way they are. But then it also then therefore shapes our kind of perceptions or beliefs about what is possible. And so I wanted to kind of create something that really sort of tapped into unleashing the limitless possibilities of knowledge, and how we could better use that to transform people's lives and our own lives. And so what we're trying to do is to build a global community who are enthusiastic and kind of really committed to building just and sustainable futures for us all. Our work is relational, so it's really about how we work alongside communities, how we build networks, but in particular how we start to critique the knowledge that we take for granted. And we're trying to create spaces where we're able to be curious, where our imaginations know no limits, and in particular how we can tap into overlooked knowledge systems and the potential for them in terms of sort of challenging our perspectives, but also how that may enable us to find better solutions to the challenges that we face as a society, both now and into the future. So that's a little bit about liberating knowledge. Today, what I wanted to do was to just basically talk about how, based on my own reflections, how co-production can support your anti-racism, thinking about what some of the pitfalls might be. And then I'm going to share some examples from my work in my previous role as the Programme Delivery Director at Black Thrive, but also some of the work that I've been doing now with Liberating Knowledge. And then just to provide an overview of the things that you could consider to make co-production a more equitable process. So if we move to, we could probably skip a few slides. So the next one and the next one. Okay, so if we if we go back one. So one of the things that we try to do is to incorporate grounding exercises in our work, and this has largely been influenced by an organisation called Healing Justice London, who are working primarily with racially minoritized communities around kind of healing and how we kind of heal from the trauma that we experience. So I'm going to invite you to do an orienting exercise. This is entirely based on consent, so just do what your body tells you it's comfortable doing. And if anything doesn't work for you, please feel free to adapt. Also very conscious that we don't necessarily all have access to our senses. So if I invite you to engage in a sense that you don't have access to, then either do a previous one or think of another sense that you have and kind of focus on that. So if we take a moment and again, just get comfortable. So the first thing I'd like you to do is to pay attention to your sight. So look around you. Take a moment, be still, and what do you see? What do you notice? What do you hear? So for me, it's the humming of my laptop. What can you smell around you? And also pay attention to your breathing while you're doing this. And what can you feel? So perhaps it may be the hardness of your chair. And what can you taste? So thank you very much. So we're trying to incorporate grounding exercises in our work because we feel it's really important for us in anti-racism work to be more connected to our bodies. And so it's not a practice that we're often used to doing, but it's certainly something that we try to encourage when we're working with people and organisations. And so I thought I'd share a fairly simple grounding exercise that you could incorporate in your own work should you choose to. So if I could take the next slide, please. Okay, so I thought before kind of delving into like how can co-production support our anti-racism work, I thought it would be helpful to just provide some definitions about racism and anti-racism so that we're all on the same page. So racism is a belief system or ideology that asserts that there is inherent superiority or inferiority between racialized groups. And as a consequence of this, it leads to people experiencing discrimination, prejudice and unequal treatment. And this is generally on the basis of their race or their ethnicity. And the way in which racism shows up in our work, it shows up on an individual level or interpersonal level. And this is the form of racism that we are generally most familiar or have most awareness of. And this is when it's perpetrated between kind of individuals. So perhaps somebody's like withholding service or mistreating somebody, or perhaps saying things that are kind of offensive or causing physical harm. But what we probably don't necessarily spend as much time in terms of exploring is the role of racism at an institutional and a systemic level. And the other area that we also don't necessarily think about is also internalized racism. And this is where people who are from racially minoritized groups may internalize messages of racism, and therefore that can have an impact on how they see themselves, but also how they see and treat other members of their same ethnic group. Anti-racism, on the other hand, is a proactive and conscious effort to challenge and eliminate racism. And it's about opposing all discriminatory practices. And so when we're thinking about when we're working within sort of systems, a lot of our policies and the work that we try to do around anti-racism is often focusing on the individual level kind of interactions. But actually, if we're going to do this work and do it well, we need to pay attention to how racism shows up in all aspects of our lives, both in terms of in a professional capacity, but also in a personal one. And it's really about dealing with the root causes. And so that really does require us to work more systemically. And the way in which we might sort of engage in anti-racism work, this can look like raising awareness, maybe through education, through allyship, although there are kind of issues around this whole notion of allyship, which we don't have time for, but I'm sure we can create space for that some other time. And the kind of trying to promote inclusive policies and practices. Could I take the next slide, please? So how is racism linked to inequalities? So I think that this is also an area where we're perhaps less aware or cited on. And so I would encourage you to engage in Professor David Williams' work. He's been researching the links between racism and health outcomes for decades. And a quote from one of his articles said that basically highlights that racism is a structured system that basically interacts with all our social institutions, and they are mutually reinforcing. So they basically perpetuate the racial hierarchy. So this ideology that there are some races that are more superior than others. And as a consequence of that, it means that certain groups, and they're often people from Black and other racially minoritized communities, are denied access to power, resources and opportunities. And all of these have an impact on our health and well-being. And these inequities show up in all aspects of our lives, whether we're looking at housing, education, employment, and so forth. Let's take the next slide, please. So when we're thinking about how we frame racial disparities, we often come up with like individual level explanations. And so like some of the worst are like the biological explanations. It's about kind of often cultural reasons are put forward as to why inequities exist, or that communities have a lack of trust in institutions. And all of these narratives further marginalize communities because it places the onus on individuals as opposed to understanding the inequities that we experience in the context of wider systems of oppression. One of the other challenges around racial disparities is data is often incomplete, so we are sometimes invisible in the data, sometimes we're hypervisible, and this has a real issue in terms of us really understanding where needs and opportunities lie. And again, data in of itself tells us some part of the picture, but actually our experiences and the nuances of our experiences are often poorly understood. And there is often also a lack of understanding of the impact of racism on health outcomes. And that's also contributed as a consequence of a lack of research on the topic. Take the next slide. So again, before I thought it'd be helpful again, like what is co-production? So co-production as a concept is used across many disciplines, and as far as I'm aware, it evolved in the 1970s out of kind of political science, but it's been adopted across, you know, many kind of disciplines. But I thought I would use the one from the NHS because I suppose it kind of provides a bit of a frame in terms of, from the NHS's perspective, what co-production is. And broadly speaking, it's about involving people who use health and care services in equal partnership. And the aim is to engage them at the earliest stages of service design, development and evaluation. And essentially what we're trying to do through co-production is to acknowledge that people's lived experience means that they are often best placed to provide guidance, advice, support around the types of approaches that we should be kind of taking in terms of delivering services. And this is really one of many tools that we should be using to involve communities in kind of shaping what we do. I'll take the next slide. And so they have a model of co-production, and it's great, you know, ownership, understanding and support of co-production by all. So this is something that there's an expectation that we all buy into this process, that there's a culture of openness and honesty, a commitment to sharing power and decision making, having clear communication in plain English, which is slightly problematic in itself, and a culture in which people are valued and respected. So if I take the next slide. So why do we co-produce? Well, it helps us to develop processes, products, services, interventions that essentially fit for purpose. If we're engaging people from racially minoritized groups, then it's more likely to be culturally sensitive. And it also creates an opportunity for us to work more systemically so that we can kind of start to unpack kind of complex issues in a way that we can kind of see like how we can make more sustainable change. And as a consequence of that, we can assume that it should improve people's access to service, their experience and outcomes. But really, what we also want to be focusing on is how we prevent people from becoming ill in the first place, because when we look at people's health outcomes, a very, very small proportion of our outcomes are actually determined by our contact with the health system. And actually, it's all about the social determinants of health. So, you know, our quality of housing, the environments that we're in, whether we have access to good work and so on. The other great thing about co-production is it also recognises that the importance of diversity of like thought, and it also helps to draw on different knowledge systems or wisdom. So again, we get to see and focus on an issue or an opportunity from different perspectives. And technically, it's supposed to create a space to stretch our imagination, gives us a chance to kind of practice, anti-racism like work, and to embody new possibilities. So it really gives us that opportunity to like practice what an anti-racism could look and feel like within an organization, but we've almost been able to practice it at a smaller scale. And it has the opportunity to like illuminate and destabilize hidden power dynamics that often go unquestioned, or completely overlooked. And therefore, if you have that awareness, you're then able to kind of transcend some of these barriers that are presented by the roles that we hold, or the kind of power and privilege that comes with different social identities. And because we're working together with communities, there's an opportunity for us to build connection, to build trust, and it can be an empowering process for all. I have the next slide. But is it all that it cracks up to be? The other side of co-production, and I'm just going to read this quote: "Co-production's ideologies and practice continue to uphold the status quo. It seems to accept the assumption that today's service user could not be the CEO of tomorrow, and often uncritically accepts that white people produce and Black people must be brought into the space to share power." Now, this is a quote that comes from a paper, a book chapter that my team and I wrote based on our kind of reflections on, as Black people, kind of co-producing with our community, and also kind of co-producing with white-led organisations within the voluntary or statutory sector. So my next slide, I'll start to break some of this down. So one of the things that we are very conscious of is that when kind of co-producing, it can be very, very easy to kind of replicate and reproduce the very power structures that our work is trying to dismantle. So again, when we're thinking about the co-production processes, or when you're thinking about any co-production that you've been involved in or have observed, my question is, how often if you're working with a racially minoritized group, have they led that co-design process? In terms of our experiences, they're often interpreted through the white gaze. And by that, I'm kind of referring to kind of neo-colonial kind of perspectives in terms of which determine what kind of is important, what behaviours are acceptable, what cultural practices are deemed to be the right way, or what knowledge is considered to be credible. And so what we sometimes find in co-production processes is that it very much, in terms of what the issue is, it's very much framed from that perspective, and also what the possibilities are again not necessarily always embracing African-centered, approaches or kind of perspectives from the global South. And so when people are trying to bring that knowledge into the space, it can sometimes be othered. One of the other things is that we identify is that sometimes undesirable co-producers are excluded, and we often kind of sort of describe these people as disruptors. So people who perhaps don't necessarily want to follow the process that we have outlined ourselves in terms of what the co-production process should look like, because potentially their views do not kind of align with what we deem to be appropriate. And often co-production focuses on kind of individual level solutions rather than working more systemically. And sometimes one of our reflections when we're bringing communities into a space, they may have like ideas or see opportunities that are perhaps bigger than our team, or bigger than the organization that we're working with. And although we're needing to frame what it is that we're trying to do, it's also really important to kind of consider what we're trying to develop in the wider context. Next slide. So again, one of the things that we also notice when people from racially minoritized communities are brought into spaces is that actually we are also subjected to either overt or implicit oppression. Okay, and that can show up by people when they're describing the challenges that we experience, often using language that is quite common, like let's say, for example, in public health, common language that's used in public health, but actually is not inclusive, which further marginalizes communities. And so we really need to be mindful. I mean, I said earlier, the number of times I've been in a space and people say really ridiculous things about my community. And again, the intention is coming from a good place. Like the intention is, I'm bringing you into this process because we want to make a positive difference. But in that space, I'm harmed. And so I think this is something that we also need to be mindful of that. And very seldom do we genuinely pay attention to how power is kind of distributed. We often think about it from the perspective of like, are we hearing people's voices equally? But we're not necessarily saying, like, for example, how does my privilege as a Black woman who is middle class by virtue of my education and my employment status, how does that dynamic, what does that dynamic kind of look and feel like in a context where I may be working alongside Black people who don't have that privilege, right? And so again, it's kind of like, are we being very deliberate thinking about that? One of the other things that kind of shows up is that people can often feel like they have to censor themselves, in particular when they're in an environment where they're talking about sensitive topics, in particular around their exposure to or experiences of oppression, whether that be racism, ableism, sexism, and at the intersections of those forms of discrimination. But through fear of not wanting to upset people who have more dominant identities, people don't feel able to bring their full self to that process. One of the other challenges that we find is that the benefits from co-design and the co-design process are not equitably distributed. So my question is always, well, who benefits from the process? It shouldn't be enough that just the improvement in a service should be satisfactory and that people from racially minoritized groups should just be happy with that. Because when we look at co-production, where does the kudos lie? Who gets the kudos for the outcome of that process? And I think that's one of the things that we need to be mindful of. How are we valuing labor? So when you think about, people kind of congratulate themselves now for remunerating people, but actually when you're looking at how that labor is valued, I'm always kind of paying attention to like, well, how well resourced are the community in, to be able to kind of show up in these spaces. And I think one of the other things for us to reflect on is that when kind of approaches that are intended to be quite radical are co-opted by the statutory system in particular, it kind of stops being it can stop it from being transformative or radical because of the constraints of the organization. So there is something about how do our organizations need to adapt to enable the co-production process to be as fruitful as it possibly can. Take the next slide. So I wanted to give an example of a few projects that have kind of used co-production, co-design, and they're not perfect, and we can probably unpack some of that. But I wanted to kind of illustrate how what this work can look like in this space. So we've got CAPSA, which stands for Culturally Appropriate Peer Support and Advocacy Service. And this is a piece of work that my team and I did at Black Thrive. And this really came from having conversations with communities for a very long time around, like, how do we address mental health inequalities for Black communities? How do we improve people's access and their experiences of services, and hopefully that improving their longer term outcomes and their recovery journey? And so this piece of work really came from community. And there were some wider levers. So there was the review of the Mental Health Act, which kind of positioned this well for this work to take place. And so what community said was that they wanted a service that was led by and for Black communities that would help them better navigate the system. And so we worked with people in the community who had lived expertise of the mental health system, both in terms of accessing it, but also as carers, and also wider communities who perhaps haven't had contact with the mental health system, but kind of trying to understand what they would be thinking, or what would be important to them if they needed to access those services. And in this process, we were really intentional and reflexive about the role of power. So essentially, our working group became a member of our team. And I think to illustrate that, and we worked in partnership with the Living Well Network Alliance. And so we were almost a kind of a team across both organisations and with our working group. And when we went to the HSJ Awards, Leroy, who's there with his thumb up, he said to me, what organisation do I put down? Do I put down that I'm a member of the Living Well Network Alliance, or do I put down that I'm a member of Black Thrive? But very much seeing like his identity as being part of, you know, our wider team. And one of the other things that we did was that, you know, I had an excellent kind of designer kind of working with us who used a race equity lens to inform the design process. So we were always paying attention to that as we were going through. And we were really explicit about responding to the impact of anti-Blackness. And again, we were really deliberate about the pace of the work. So this co-design process probably took about a year. And we were very lucky that the Living Well Network Allowance essentially said, here is your budget, do what you need to do. And I think as a consequence of that, we have designed something that really shows promise of improving outcomes for Black communities. Can I take the next slide? So the next one I have is the Healthy Happy project that was funded by North Central London ICS, and it was commissioned by Enfield Council. And we worked in partnership with Middlesex University and IDEO Consulting. And they were really keen to understand the experiences of kind of people in Enfield who experienced the poorest outcomes, but were aware of the kind of quantitative data, but felt it was really important to sort of start to surface stories. So the team that I was kind of working with, we went out into the community, kind of door knocking, sort of talking to people in like the shopping centres to try and recruit people into the kind of project. And so we trained 25 local people in qualitative skills. And we basically shared with them like the data that was available on health inequalities in Enfield. And we basically said, you know, we'd really like for you to sort of like lead on a research project, any topic of your choice. And so people were able to bring their own lived expertise, the things that they were passionate about, and to really focus on them. And so we worked with them to co-design their own research projects. We supported them around the engagement, analysing their data, and then presenting it back to stakeholders in terms of what we found. And again, we made sure that researchers were remunerated for their participation. We weren't able to remunerate them in the same way that we were with the CAPSA programme. But yeah, this is another example of kind of communities essentially like leading on the things that are important to them being at the forefront of kind of shaping what we focus on, but also what that narrative looks like. Can I take the next slide? And then what it means to be seen project that was funded by the Understanding Patient Data team, and they were interested in understanding why there were gaps in patient data for Black and South Asian communities. And this was kind of building on research that had been done, listening to communities about their attitudes toward data. So Liberating Knowledge, we focused on the perspective of healthcare workers, and then we brought that information together to work with community members from the Black and South Asian community and healthcare workers to co-design resources. Because one of the things that came through the research was that healthcare workers were reluctant to have conversations with communities. One, because they didn't really know what happened to data or why data was collected if they didn't use it in their work. And two, they were concerns about being perceived as racist because they couldn't see the link between, like, why do I need to know or ask a patient about their ethnicity in order to provide them care? And so what we did was we co-designed resources with communities to make sure that people were able to hold meaningful conversations. So we produced 2 guides, and that was also supported by an infographic, and I can share the links to those later. But again, one of the challenges of this piece of work was that the pace at which we had to work. But I suppose one of the positive elements of this is that we made sure that everybody who participated in that co-design process were acknowledged as authors on our, on the final sort of products that were produced. The next slide. So when we're thinking about co-production, what do we need to consider? So holding that tension, that it can be true, that it's, yes, it's an imperfect process, but it can also be an effective tool. And then when it comes to, we're often working in imperfect context. So do something or do nothing. That is a question that you have to ask yourself. But the key thing is, if by doing something you're going to cause harm, are you ready to do it? Don't rush the process, and ensure that kind of you're working at a pace that works for communities, because again, it can sometimes just be so unfruitful by kind of just following a process, waste of people's time, resource. Remembering that this is relational. So again, it goes back to that, don't rush this. You need time to understand whose voices are missing, being very aware of kind of who is taking the lead. And ideally we want people with lived expertise to be leading, and be very clear about what the purpose is, and that and that people are very aware of what the boundaries of the work are. And again, I keep saying, let's not replicate the harms, but kind of create safe spaces. And kind of, when I was saying things like grounding exercises, those sorts of things, being very aware of kind of like the trauma that people may be bringing into the space, that that there is that support network and support for them. And again, being very reflexive about power, what we're learning, what we need to unlearn is going to be key. Can I take the next slide? And as I said, always consider the issue you're trying to address in the wider context. Make sure that you're valuing the labour of communities, and that any benefits that come from that process are equitably distributed. So really think, where does the intellectual property lie for this? And I think when we're working through and coming towards the end, we need to be honest about the limitations and reflect on the process, so that the next time that we do it, we know that we can do much better and build on that. And just to remember that co-production and community voice, we shouldn't be just relying on that process in order for communities to have a say about how their services are delivered. Can I take the next slide? So I suppose as an overview, co-production can support anti-racism work in multiple ways, but the replication of systems of oppression is a genuine risk. But despite this, it is possible to make a positive contribution in terms of addressing inequities. But essentially what we have to remember is that we individually play a role in the translation of co-production's intention and outcome. And so if we don't want to replicate those harms, we need to make sure that we're doing the work ourselves to make sure that we are doing the best when working with communities. So if I take the next slide. So again, I'm ready for questions.
Thank you, Natalie. So if we, I don't know, would you prefer if everyone would just kind of share their questions verbally, or would you prefer it to be in the chat?
I don't mind.
Okay. Christine, do you mind unmuting everyone, and then I guess we can just take questions?
Don't be afraid.
So if anyone has a question, you can either just raise your hand or just kind of go. Clara?
Hi, hello. I'm Clara. I'm really new to the council. I'm 2 weeks in, and I'm also new to co-production. So that was really helpful. And I should give some context in that. I'm the community equality officer, and we're going to be integrating co-production into the development of our equality strategy. So one of my questions was actually about. Oh, sorry, that's my phone, my laptop popping off. You mentioned at the end that we should be. Sorry, I've memory problems as well. We should be honest about the limitations of co-production. I don't know if this is a silly question, but I'll go ahead with it anyways. Do you think that we should be honest about those limitations from the beginning in terms of with our co-producers as well? Or is that discouraging? Just in your experience? Yeah.
I mean, I've found honesty to be the best policy. Because yes, some people might decide to disengage, but I guess for a lot of racially minoritized communities, the distrust that we might have towards institutions is because we've been lied to. Our hopes have been raised and they've been dashed. And so often when I'm working with communities, I would just say, like, I don't know if this is, like with the CAPSA program, it was like, okay, we're going to go through this process, but are they actually going to take this on board? And I just had to say, well, I don't know, but I'm hopeful. There are signs that they, you know, that there will be, and kind of asking them to sort of trust the process. But I think that having that transparency again is a way of leveling the playing field in terms of like power, because if you know that there are limitations but you're not sharing that, you have that knowledge and you're retaining that power, and you're not actually giving communities the opportunity to decide whether this is for them or not.
Yeah, that's really helpful. Thank you so much, and definitely something for me to take forward and consider for our own work. So thank you.
Thank you. Chris, do you want to go next?
Thank you. Natalie, I can't see you, which is a real shame. But hopefully you can hear me. Yes,
I can hear you. Yeah.
Good. So I have a question about speaking truth to power. If my lived experience of services within the mental health field have been excellent, but I know that my individual experiences are not shared by the wider Black community, let's say Northwest London, but now I'm in a position where I can use my narrative to help influence policy and strategy and so on and so forth. How do I go about speaking truth to the powers that be, that hold the purse strings, and ensuring that they take that on board? Can you share what your thoughts are around that?
So I think obviously when we're thinking about people's experiences of services, it will be variable. And I think, you know, not everybody will have a terrible time in the mental health system or other health systems. But what we do know is that disproportionately, people from racially minoritized groups do. And I think there can be a challenge. So like when I used to sit around boardrooms, people were like, well, what do Black people think? And I used to be like, well, I can tell you what I think. I can't necessarily tell you what every other Black person experiences because we're not a homogenous group. And again, I think it's just about being honest about that, because I think sometimes when we're brought into spaces, there is an assumption that we are the sort of spokesperson for the whole community. So I think when we have access to those spaces, I think there is a onus on us as representatives advocating on behalf of our communities to make sure that we are actually engaging outside of those spaces with people so that we are able to, I suppose, kind of share their experiences. But I think for me, the other element is I'm always thinking about how I can get people who are closest to the issue in that space so that I'm not necessarily speaking on behalf of, but being that kind of conduit to enable people to have access to those spaces. And again, it comes back to that whole thing of like, if you have that privilege to be in a space, how do you ensure that others who perhaps are not as privileged are also able to have their voices heard?
Okay, that's a fair point. But you know as well as I do that that's often not practical. How do you do that? Because it's not practical in many cases.
So in different ways. So you know, sometimes it can be you know, so for example, we were looking at the Living Well Network Alliance like access sort of like process to kind of being referred in. And so rather than me making a decision about like how that should be, you know, I asked for, you know, some resource to be able to go away with my team to actually engage with communities to develop what the referral form, you know, looked like. And so again, people may not necessarily have been in the room, but actually they were still able to influence those decisions. But with the CAPSA project, our working group were involved in everything from the ethos of the program to developing the business case, to presenting the business case, the recruitment of our staff. So they were involved in the whole process. So I think, again, it depends on like being pragmatic, what time you have, what resource you have. But I think it was an illustration that this work can be done and it doesn't necessarily have to be onerous.
Was that CAPSA project, was that done with the McPinn Foundation?
No, so that was done with the Living Well Network Alliance.
Oh, okay. Okay. All right. No, thanks for that, Natalie. Some good. I was just thinking about the practicality. If we can't bring the mountain, is it the right way around? If we can't bring the mountain to Muhammad, we bring Muhammad to the mountain.
Yeah,
if that's the right way around. Yeah.
Yeah, and you can also create spaces for senior leaders to meet with communities, but sometimes community leaders do also need to be, not communities, I mean senior leaders also need to be briefed, because again, they can sometimes come into those spaces using language that is not appropriate. And so it almost has the reverse effect, or they tend to try to defend, because it's about like protecting the organization. And so it's kind of been very explicit that your kind of role here is to listen, not necessarily to like respond with a solution, but just to hear what communities have to say, and then maybe come back and say like, I've had a chance to like reflect and think about what you said, you know, and I think that can sometimes also be a helpful process.
Thank you, Chris. We have one more question in the chat box from Martin. It says, thanks, this is really helpful overview of considerations we should make when co-designing. He's asked, could you say a little bit more about managing disruptors?
So I always find disruptors, I mean, even like end up often being your biggest fan. And so they're the people who perhaps always find a problem with whatever it is that you're trying to do, or that nothing will work. And I think it's quite easy to sort of think, oh, goodness me, like they're such a pain. But if we kind of flip that kind of our thought process about that behavior, sometimes it's about the anxiety about whatever it is that you're trying to do not working, because they just can't face the disappointment again. They're almost sometimes like your litmus test of like whether or not this is going to work, how it might be received by different sections of a community. So I think that as much as possible, you might not necessarily want, sometimes, I mean, I've done had sessions where like sessions have been completely derailed, and that can happen sometimes. But again, it's like creating that space to reflect as a group on like, why has that happened? What impact has this had? So that people are able to still feel part and not ostracized, because if they are ostracized and dismissed, it can make the situation worse. And you'll find that once you've kind of got people on board, they will generally be your biggest fans. And that's what I found historically. But also kind of thinking about like, is this you know, a sign of like trauma, or like just various things? Are there things that you are doing or your process? Like if, say, for example, you've got exercises that are not accessible, then people might not necessarily want to, you know, engage because they can't. So it's just about always constantly like reflecting on, is there something that I could be doing differently, and having that conversation with the people that you're working with.
Thanks, Natalie. That's very helpful. I do know, like with disruptors, it can be very difficult for some people to manage, but they do have to reflect on if they're being inclusive. If it's just because it's culturally different to how they're used to being spoken to, for instance, or the person is not. I think when you're consulting people, you know, people aren't all used to how you speak at a meeting, and you have to bear that in mind and maybe speak to people after the first session or whatever. But sometimes in the past, I've been in organizations where disruptors have been tolerated to such an extent that other people withdrew from the process, and we ended up getting less information. Whereas I kind of would, if I couldn't show them how they were not helping us to get the information we wanted, or to retrieve the information from themselves on a one-to-one, then I would look to remove someone in that situation. But it's really difficult. But I think most people who work in engagement are doing it with a genuine desire to include everyone.
Yeah, and I think, you know, again, one of the things that you're trying to manage is not to kind of create harm or create a space that is harmful to people. So I think that that's a tension that we're always having to hold. But for me, removing somebody is always the last resort for me.
Absolutely, yeah.
And it's always about, well, how can we make this work? Like, what is this that isn't working for you? And it might be that the process or the timing just might not be right. And I think, again, it's okay for people then to decide that, you know, that they'll walk away. But I think it's always important to try and maintain that relationship, so, because, you know, you never know, in like 6 months' time, a year's time, you know, their insights could be really valuable to, you know, your future processes or projects.
For sure. Yeah. Thank you.